Hi, Dr. Asif here with you, and my today video is very much important because appendicitis or appendix inflammation is more common in our society, and the main theme of this video is just to make you capable that how you will diagnose appendix at home, because mostly you are getting this emergency at night and then you are rushing here and there and you don't know that it is appendix or not, and the doctor then decide by himself that whether it is appendix or not. In most of our Asian countries, they are doing unnecessary appendectomy just for the sake of money. So the main theme of my video is to avoid such things, and it will make you capable that you will diagnose appendix at home. So here is I will demonstrate it on my son, and I will show you the main signs of appendix that you will see in a patient of appendicitis. Beside this, the symptom, he will present with the abdominal pain. In the start, the abdominal pain will be around the umbilicus. Then within 6 to 12 hours, it will move to the right lower quadrant. A point we call it McBurney point. I will show you practically where is the McBurney point. And this symptom will accompany by fever and nausea and vomiting. So if your kid or someone else, because it's not only a disease of kid, although it's more common in kids, but even after 20 years of age you can face this problem at home. So after this video you will be able to diagnose appendix at home. So I'm going to demonstrate it very shortly. I will just show you 6 signs that accompany abdominal pain, fever, nausea and vomiting. If a boy or if a patient has these symptoms along with these signs, then there is a more chance that it is appendix is already inflamed. And we will start the demonstration. So the ways I'm going to examine you for the appendicitis. Okay, so just the first thing in the patient, what you will see, that this is the umbilicus, and there is a crust, there is a bony prominent here that is called the right iliac crust. So between the right iliac crust, just divide this area into 3 parts, and the 2/3 from the umbilicus toward the iliac crust, this point is called the McBurney point. So in appendicitis, when you are pushing this point, the patient will definitely feel pain, tenderness in this point. So this is the first sign you have to examine in your own kid, that whether he has appendicitis or not. The second sign is rebound tenderness. Rebound tenderness, when you are moving your hand back from the patient, he will feel pain like this. I push it, then I leave it, and he feel the pain. So this is the rebound tenderness, the second sign in the same area of the McBurney point you have to examine. The third point, when you are pushing it on the left side of the lower quadrant, he will feel pain at the same in the right lower quadrant. So if I'm pushing here, look, he's feeling pain here in the right lower quadrant. So this is the third sign. The fourth thing, the lower abdominal muscle will be rigid and hard. It will be not soft like what we have normally. Now the fourth sign is when I will ask the patient to cough. While coughing, he will feel the pain. Dores, cough please. Now with cough, he will feel the pain in the same area. This is one of the other sign of appendix. And now the last one is, we call it sauce sign, and just put your hand, press the right thigh of the patient with your hand down, and ask the patient to raise his leg. If with this he feel the pain in the same right iliac fossa, then it is appendix. Raise your this leg to raise. So if you feel pain with this raising of the leg, the sauce sign is also positive. So look for all these 5-6 things in a patient, and also the symptoms of lower abdominal pain accompanied with the nausea and vomiting. Temperature may be or may not be there, but in most cases low grade fever is there. If these signs are there and the symptoms are there, there is a more possibility that the patient has appendix. After this, you will go for a complete blood count, CBC or full blood count, and look for the WBC count. If the WBC count is more than 11,000 with the predominant neutrophils, then the possibility of appendix is more. Let it confirm with ultrasound before the surgery. If there is no such signs or the signs are deficient, the CT scan is the only 100% diagnostic tool. The CT lower abdomen will show you that appendicitis is there or not. I'm hoping so that after this you will not feel emergency when someone has abdominal pain and you are suspecting appendix. You will just take the history, you will just go for the signs. If these signs are there, there is a chance of appendix. If these signs are not there, in these signs the most important one is the right lower quadrant tenderness and the raised WBC count. That has a more score than the fever, nausea, vomiting and other symptoms. So look for the right lower quadrant tenderness, look for the WBC count. If it is associated, raised WBC count with nausea, vomiting and fever, there is a more chance of appendix, and then you should proceed for a surgeon to do surgery. Thank you.